Greetings, this is Dr. Rozakis, and thank you for being here to listen into this presentation on the future of medicine. On behalf of Dr. Bakke, my good friend and PhD, again, we welcome you. My background is ophthalmology. I'm also a biomedical engineer. I trained at Cornell and Duke. I've been in private practice for about 30 years. I was one of the persons that helped develop LASIK eye surgery between 1992 and 1996. I'm very interested in what causes disease. I was very fascinated by my years developing LASIK eye surgery, but quite frankly, this is even more exciting. Dr. Bakke is a PhD in bioorganic chemistry. He's an expert in methylation biochemistry. That's in red because you will find that methylation is extremely important. He has also done research in chemotherapy using methylation. He's an expert in the biochemistry of food. He's also interested in what causes disease, and he was instrumental in developing fascinating new strategies to help treat migraine. I'd like to tell you about patients who were suffering until they came to see us. That includes Stacy, who was diagnosed at the age of 12 with migraine. She went through 25 years of migraine therapy without any success until she came to see us. Barb had migraine since the age of 6 and until the age of 37 finally saw improvement when she came to see us. Marla is a patient who had migraine as well, and she too was unresolved with current medical therapy. Here's Pat, another migraine sufferer who also had problems related to menopausal symptoms. And then the problem of Asperger's. Here's a child who is nameless. He's from Florida, and he was having quite a number of difficulties with his Asperger's syndrome until he came to see us and we were able to help him. Here's a patient, Charles, with ankylosing spondylitis, who suffered for 10 years in pain and in a brain fog, and we were able to benefit him as well. Here's Kelly with Parkinson's, who also benefited from what we are going to talk about tonight. And here's Rick, who was having trouble with depression and elevated cholesterol until he came to see us. And here's Ray, who was having difficulty focusing, joint pain, and fatigue, even at the young age of 42. And when we were able to balance him, he improved significantly. Here's Melissa. She had rheumatoid arthritis and was suffering and was in pain, and she too benefited enormously from what we're going to talk about tonight. And here's Susan. Susan had bipolar disease. She's young. Susan's father brought her to us. She was on lithium and other medications without resolution, and she is now off of her medications. And this patient, who was receiving injections into her eye to manage her diabetic macular edema, who also improved significantly without those injections. Eric Topol is the head of the Scripps Institute in California, and he writes, "The practice of medicine today is obsolete, extremely wasteful, driven by patient crisis and perverse incentives." Those are pretty strong words from a cardiologist who used to work at the Cleveland Clinic and university hospitals. But he says the practice of medicine today is obsolete. I agree with him, and I think it is obsolete because it does not have a feel for what is causing disease. And because there's no clear understanding of what causes disease, the practice of medicine is wasteful. And again, because we don't understand the cause of disease, the practice of medicine is driven by crisis. If you don't know the cause, you're not going to do anything to prevent it, and therefore when disease strikes, such as a heart attack or a broken hip, then the current healthcare system goes to work. And perverse incentives just has to do with the profit motives that exist today. So patients and society are suffering, and in the context of that, the government, by way of the Affordable Care Act, is demanding improved patient satisfaction and reduced costs, considering that 75% of healthcare is chronic disease, for which we generally don't know what causes it. And as you can see, the price of medicine continues to escalate. And on top of that, we're adding 50 million new patients. So how are we going to control costs and improve patient satisfaction? Sounds like a very daunting task. But there is a solution. In 1990, the United States National Institute of Health began an effort to map the human genome. This effort, known as the Human Genome Project, is considered the birth of personalized medicine and was successfully completed in 2003. It took $4 billion to complete. And that is what we are going to talk about today. We are going to talk about personalized medicine, otherwise termed epigenetics. To do that, we have to go down to the most microscopic level of which we are made, and that is the human cell. We are made of trillions and trillions of cells, and every cell in our body has DNA, and that DNA produces the biochemistry which makes us tick. And here are cells. This is a cross-section of the retina, and you can see how light goes in this way and comes back to the rods and cones. This is a blood vessel here, and here you see the endothelial cells that line the blood vessels. Here you see two nerve cells touching each other. Here you see these little blue spots which represent immune cells. The big idea is that when our cells become sick, we become sick. It just depends on what cells become sick that determines your chronic disease, which, as we said earlier, accounts for 75% of our healthcare costs. So, for example, if these cells here become sick, that is where macular degeneration occurs, which is the #1 cause of blindness today. And if these cells become sick, the endothelial cells, then you're looking at cardiovascular disease and atherosclerosis and heart attack. If these nerve cells become sick, then you're looking at problems related to psychological disturbances and migraine. And when these cells become sick, you're looking at autoimmune diseases such as rheumatoid arthritis and lupus. So the question is, how do I improve cellular function? Isn't that the question? Absolutely, it's the question. And the answer is you can do so by optimizing cell function by way of hormones, genetic methylation biochemistry, and nutritional biochemistry. I'm going to go here first because it sounds very complicated, but it's incredibly exciting. And that again is because of the Human Genome Project. The Human Genome Project defined the genetic software that makes enzymes, among other things. But still, this is what I want you to focus on. It defined the genetic software that makes enzymes. So here, for example, is the code within the gene that produces this enzyme right there. So what does an enzyme do? You need to understand this. This is really important. An enzyme takes substances, such as A and B, brings them together, and produces something new, a product, AB. And you need AB to live, to be alive. It can be one of tens of thousands of substances inside your body. But this is how it works. You have software, which is your genetic code, producing your enzymes, which produce product AB. Let's keep going. I told you that to prepare you for this diagram here called the methylation pathway. And everywhere you see a colored spot, you are looking at an enzyme. And that enzyme was created by certain genetic software or genetic coding in your DNA. Okay, so this little arrow here says that this genetic code produced that enzyme there. This genetic code produced this enzyme here. And what you're looking at overall is a biochemical pathway. So for example, here's homocysteine, which is something you may have heard about. And homocysteine is transformed into methionine by way of these types of enzymes here. And then methionine is transformed into SAMe by way of this enzyme here, MAT. SAMe is extremely important because it actually methylates, which means puts a carbon atom into many different substances in your body, especially your DNA. So you're looking at the underlying biochemistry of how DNA is controlled, i.e. turned on and off. It's done so by way of SAMe, which ultimately comes from homocysteine. If you go down this pathway, you reach glutathione. Glutathione is extremely important as an antioxidant. If you're not making enough glutathione, you are susceptible to a wide range of conditions, as for example, a cataract. So when I look at an eye, for example, and if I see cataract starting, I know that that means the person is having a problem with oxidation. Look here, serotonin, dopamine. These are your neurotransmitters, and your neurotransmitters are very much involved in migraine and many of the psychological disturbances, ADHD, as well as bipolar disease. Okay, so this one pathway accounts for how your body manages DNA, how your body fights oxidation, and how your neurotransmitters are produced. Critical. This is a critical pathway. And what happens is that if you have errors in your genetics, these enzymes are not going to be made properly. And if they're not made properly, their speed is off. The kinetics, the speed, the rate at which these enzymes work. So for that reason, I put a little 5-mile-an-hour speed limit there. That should be 65 miles an hour. But because this MTHFR enzyme is not working properly, as shown by this red line here, this enzyme is in trouble. This enzyme is slow. Okay, and you could look into the genetics and see that. This is the big idea. Don't miss this idea. Furthermore, some enzymes can have genetic errors which make the enzyme too fast, as shown by this 200-mile-an-hour speed limit. Okay, so look now at all the red lines. This is a patient who has problems here with MTRR, problem here with BHMT, a problem here with CBS, and all these letters are just code words for enzymes. Here's a problem with MAOA, which breaks down serotonin. Here's a problem with COMT, which breaks down dopamine. Okay, and here's a problem with MTHFR, which makes methylfolate. That's a problem. And the reason it's a problem is because if you have these errors in enzyme speed, this is what you get. You get massive traffic jams in your biochemical pathway. I don't know how else to best describe this to you, but if you take a 5-mile-an-hour speed limit and put it on a 4-lane highway, you're going to get what you see here, just a jam, a traffic jam, a total mess of your biochemical pathways. And these are critical biochemical pathways, right? They control your DNA, they control glutathione, and they control how you make neurotransmitters. And that is why all of these diseases you see here are caused by errors in enzyme kinetics. I can't think of a bigger, more exciting revelation in medicine today than this. You're looking at the problem of chronic disease in the United States. You're looking at migraine. You're looking at fatigue. You're looking at ADHD, fibromyalgia, depression, Alzheimer's, macular degeneration, heart disease, Parkinson's, bipolar. And notice how it affects all the specialties. Right? Where's the gastroenterologist? Oh, here he is, irritable bowel syndrome. Where's the rheumatologist? Oh, here he is, lupus. Where's the endocrinologist? Right here, Hashimoto's. Here's the pediatrician, autism. Here's the oncologist, cancer. Okay? This is crucial, and it's all in the literature, by the way. If you go and search under methylation and pick those diseases, you'll find paper after paper on how methylation pathway disturbances are related to these conditions. So these illnesses are errors of genetics causing imbalances in your biochemical pathways because your enzymes are too fast or too slow, and that is wreaking havoc in your biochemical pathways. It's causing traffic. That is the big idea. That's why we're here. And I've just given you the cause of a great number of medical conditions thanks to the Human Genome Project. This is not just me talking. It's $4 billion worth of research. And isn't it similar to the bubonic plague? 75 million people died in 1348, and they had no idea why, did they? No idea why. They just developed these lesions and died. And sure, I'm sure their healthcare costs went up enormously. And what was it due to? It was due to a germ. Today we kill that germ. And in 5 to 10 years, we will be fixing many of those diseases that I just explained to you by understanding the biochemistry. We published this on February 13th. We called The Human Genome Project has delivered on its promise to treat disease, introducing GEMS, the Genetic Enzymatic Methylation Syndrome. And the key word is treat, because today a lot of people talk about genetics like it's something to be feared, like, oh no, don't check my genetics, I don't want to hear what's wrong with me. Well, that's silly. Well, maybe it's not silly if you're not going to do anything for the person, but if we're talking about treating, now you're dealing with an entire different opportunity, because we can look for the genetic errors and then treat the problems. Let's talk about hormones now. Another extremely powerful way to produce wellness. Hormones, many a time, work at the genetic level also. I consider hormones to be similar to putting your foot on the gas pedal of your car. And the further down you push, the faster you go. And that's what hormones do. If you take your foot off the gas and your hormone levels have declined, you're going to slow down and you're going to age. And that's why I have this slide here, which shows that hormones decline with age. Here we are in our 20s, our hormones are raging, pumping, or pushing our genetics to produce as much biochemistry as possible, and then it starts to decline, as shown here. And again, hormone decline is one of the causes of aging. Here are the hormones we're talking about. These are steroidal hormones, pregnenolone, DHEA, estrogens, progesterone, testosterone, and cortisol. I'll go through these fairly quickly, but you'll see my point. Hormone decline is related to elevated cholesterol. Isn't that interesting? Well, cholesterol is the precursor of all of these hormones. So when hormone levels decline, there's a mechanism by which cholesterol levels elevate. And conversely, if you balance these hormones, especially those two, you can bring down cholesterol. Hormone decline causes menopause, no mystery there. That has to do with the decline in progesterone and later on estrogen. Hormone decline increases breast cancer risk. That's quite a statement, isn't it? But it's based on 10 years of work in this field. Bottom line is, if a woman's testosterone declines, she's at a greater risk of breast cancer. If her progesterone declines, same thing, because progesterone is very calming to the breast. And you simply have to be a little careful with how you use estrogens, because they do stimulate, but progesterone is a far stronger suppressant to breast cancer activity. And the big problem that occurred back maybe 20, 30 years ago is they gave a substitute for progesterone, and that substitute drug for progesterone actually was stimulatory to the breast and did cause cancer. Tremendous mistake in medicine. It's embarrassing. Bottom line is progesterone, testosterone reduce the risk of breast cancer. Same thing with DHEA, which strengthens the immune system. Hormone decline causes erectile dysfunction. Here I'm talking about low levels of testosterone and elevating estrogens. Hormone decline causes fatigue, especially with regard to cortisol, DHEA, pregnenolone, and all the hormones actually. And hormone decline causes enlarged prostate problems when estrogens go up and testosterone goes down. And hormone decline can lead to migraine, especially when there's imbalance between progesterone and estrogen. We're proud of one of this innovation I'm showing you, which is that you can abort a migraine with progesterone if your body temperature is low. It's very interesting. If your body temperature declines, and Dr. Bakke actually was instrumental in figuring this out. Dr. Bakke is my PhD partner. If you give progesterone under the tongue at the beginning of a migraine, especially if your body temperature is low, you can abort the migraine. So if I was getting a migraine, or more specifically if my wife was getting a migraine, I could check her body temperature and give her progesterone, maybe some Excedrin, and that would help her abort the migraine. It works. It's exciting. And we put this out on December 20th. We probably should re-release it because it continues to work, and not very many people have heard the message loud enough, unfortunately. Question: why are you young and sick? Why are you 30 years old and have lupus or optic neuritis or MS or other medical diseases? The answer is because your hormones have declined and you have genetic enzymatic methylation syndrome. That combination of problems causes illness, and that is why you're having difficulty. Okay, finally, let's talk about nutrition. And people talk about nutrition in a very loosey-goosey way. I'm talking about nutrition as based on your methylation biochemistry. If you have problems in your methylation pathways, you're going to have problems with certain foods that you eat. For example, if you can't make enough SAMe, you can't break down histamine. If you can't break down histamine, you're susceptible to migraine. If you have problems with MAOA and COMT, then foods that contain tryptophan and tyrosine and tyramine are going to overwhelm your neurotransmitters. And if you've got a CBS polymorphism, then this pathway is going to run very hot, and anything with sulfur in your diet is going to go ripping down this pathway and hit SUOX here and overwhelm that enzyme, and that's going to cause a whole slew of problems in you. So you can look at a person's biochemistry and you can adjust their diet strategically, and it works, flat out works. It's phenomenal. How do we evaluate patients? Family history. Family history is crucial. Remember that whole list of diseases we talked about earlier for GEMS? If you listen carefully to the family history, you'll hear GEMS. If a person says they have migraine and tell me about your dad or your mom, oh, mom had migraines too, and dad had a drinking problem, and or he had a cancer, or somebody has lupus or rheumatoid, or my kid has ADHD. All of that is GEMS. So family history matters. Let me give you an example of that. Here's a mother, and here's her genetic errors. She's got an MTHFR, an MTRR, BHMT, CBS, and an MAOA down here. And if we click to the father, that's what he looks like. So he has an MTR. If we go back to mom, mom doesn't have the MTR. But if we go forward to the father, he does. And these two people produced this daughter. She's got the CBS polymorphism. She picked that up from her dad. She's got the BHMT, the MTRR, and the MAOA, and she's sick. She's got tremendous difficulty with migraines and other issues, food intolerances, etc. All predictable. And here's the son. He picked up a double mutation. That's why this red line is thicker. He picked up a double mutation from his parents. Let's go back a step. Look, the daughter doesn't have an MTHFR, but the father had one gene and the mother had one gene. So the daughter, she missed the MTHFR error. The son got a double mutation in that gene. So that means he has a 5-mile-an-hour enzyme there that is going to cause him quite a number of difficulties. Okay, so after we've worked up someone, and I didn't say earlier that our workup includes family history, genetic testing, and hormonal testing. Once we know what your hormonal levels are, we can go ahead and give you the right hormones and the right dosages. We can adjust your nutrition to compensate or be in harmony with your genetics and your biochemistry. And also we will go ahead and strategically fix and balance your methylation pathways. One simple idea to help you understand that is if you're not producing something because you can't, we give it to you. So if you have a 5-mile-an-hour enzyme that's underproducing a substance, and we give it to you, okay? And it's not easy. This is absolutely not in any way, shape, or form giving a drug such as Lipitor or amitriptyline or an antidepressant to a patient. That's pretty straightforward, isn't it? Doctor, my cholesterol's high. Okay, great. Here's your Lipitor. Doctor, I'm feeling depressed. Okay, great. Here's your antidepressant. Yeah, that's not very difficult. But this is a bit difficult because you're balancing genetics, the methylation pathways, food is medicine, and you're also managing hormones all simultaneously. And exercise and lifestyle also matter. So I like to think of this as a 6-dimensional chess game. And so what we do at XR is we help doctors manage this chess game of care to help them help their patients, especially those who are not responding to mainstream medical therapy. Here's a question. Okay, hold on, slow down, Dr. Rozakis. Easy does it here. You're throwing a lot at me. You just told me that every one of these diseases is to some degree if not completely, caused by errors in my genetics causing certain enzymes in my methylation pathways to be abnormal. Okay, well, what disease do I get? Why don't I get all those diseases? Yeah, I'm not getting this exactly. What am I missing? That defines the concept of epigenetics. You see, we have genetic risk factors for disease. I have a genetic risk factor for lung cancer because my dad had lung cancer. So what can I do to suppress my propensity of lung cancer? The answer is I can fix 1, 2, 3, 4, and 5. I can minimize my stress, exercise, eat a healthy diet, make sure my hormones don't decline, and if I have methylation pathway disturbances, fix those. And that is epigenetics. It's what can I do to suppress my risk factors? And that's what the Human Genome Project and what epigenetics is. It's extremely exciting. So that's how you protect yourself against disease. You don't let those risk factors get you. If you don't do 1, 2, 3, 4, and 5, then you're going to be looking at drugs probably, and your genetic risk factors will manifest themselves, will become part of your life, which will harm your quality of life immensely and the like. And if you think I'm kidding about my dad and lung cancer, the literature supports everything I'm saying. And here's a paper that says, despite the importance of genetics, epigenetic mechanisms are perhaps the predominant drivers of cancer. Look at that, the predominant drivers of cancer. In particular, inadequate methylation is the most common DNA lesion of cancer cells. I didn't publish that. I found that. I found that in PubMed. I just went to PubMed, which is where you research literature. I typed in methylation, I typed in cancer, I typed in epigenetics, and they all pop up. Here's a child with autism. And look at all the errors he has. My God, look at all these errors. They're everywhere. I looked at this and I said to myself, well, if this is true, then autistic children should be at a greater risk of cancer. We have a patient down in Florida, for example, who's got disseminated prostate cancer, and he had these errors here. So he's not making enough SAMe, so he's not controlling his DNA, and he developed a cancer. He was hypomethylated, inadequately methylated, right? Like we just saw 2 slides ago. So I thought to myself, I wonder if autism is related to cancer. So I searched on that, and sure enough, I found a paper. Look at this. Autism is associated with high rates of genomic aberrations. Well, that makes sense because an autistic child is having a heck of a difficult time making SAMe and methylating his DNA. So he's going to have a problem with genomic aberrations, including chromosomal rearrangements, etc. These observations are reminiscent of cancer, a disease where genomic rearrangements also play a role. And they did, in fact, find a few cancers that autism was associated with. So it is consistent. The theory bears itself out. Enough on cancer for right now. Migraine. Let's go back to Stacy. Stacy had 25 years of migraine, diagnosed at the age of 12, and until she saw us at 37, she could not find a solution to her problem. So she came to see us. This is her genetics. She has a problem with MAOA, which affects serotonin, which can lead to migraine. She has a problem with COMT, and she also had a CBS polymorphism, and she had trouble working homocysteine back up to methionine. And when we figured her out and gave her the right nutritional recommendations and the right nutraceuticals, she was young, she didn't need much in the way of hormones, but when we did all that, she resolved. It's fantastic. Absolutely fantastic. No more fatigue, no depression, no memory problems. Her quality of life improved dramatically. She's not taking any drugs. She has no drug side effects. And on top of that, we are preventing future diseases that she would have been more susceptible to based upon her genetics. Here's a fella, Thomas. He has Asperger's syndrome and ADHD. I put ADHD here because these are the same diseases, quite frankly. They're different variations on a theme. Autism, Asperger's, ADHD, they all look like this. They all have multiple genetic errors across the board. And when we took this fellow and gave him what his body was not making adequate amounts of, he improved dramatically. Autism is this research actually came out of the autism world, the methylation biochemistry research. So why now? Why more autism? The answer is in large part because of our food supply coupled with these genetic errors. It used to be that our food supply protected us from our genetic errors. We would eat 5-methylfolate, for example, and we would, manage our genetic errors by the foods we ate. Our food supply is not what it used to be. Dr. Bakke could go on for hours talking about that because of his background in that space. And so we're naked, if you will, with regard to our genetic errors. In a perfect world, mom and dad would have their genetics looked at. They would know probabilistically what the chances are for their child to have these types of errors, and we could have treated mom before the child was even born. And when the child was born, we could have balanced out these biochemical pathways. That's how you manage autism. Here's an ADHD patient, and again, you see very similar errors. And here's a patient with diabetes. There's a nice paper in the literature that says that type 1 diabetes may in fact be related to methylation pathway disturbances. So we have to get the pediatricians to look at this and pay attention to it. In the world of pediatrics, if you're a pediatrician listening to this, every child that comes in to see you with a headache or a recurrent headache, early migraine, any rheumatologic disease, the propensity for type 1 diabetes, have them spit in a tube and run their genetics. Find out where they have methylation pathway disturbances and treat it. And that's the power of cellular medicine. We said earlier that medicine is obsolete, right? Dr. Topol said that for those of you who missed those earlier slides. And it's very wasteful. And we only take care of people when they have acute care needs. And he's right, because we don't know how to prevent disease. We really don't. You can tell someone eat better, exercise, but if you have genetic errors, it's hard to prevent disease if you have genetic errors. So our healthcare system is a mess because we just don't know how to prevent disease. Now we can treat disease, as these patients I've shown you, but that's after the fact. We could have prevented those diseases by optimizing cellular physiology, using hormones, gems, and nutritional biochemistry. This is the big idea that has to be screamed out. For those of you listening today, tell your friends. This is something you scream out from the rooftops. So we can relieve a lot of suffering by treating the cause of the conditions out there. And by doing that, we can lower the cost of healthcare. And again, these are many of the conditions that are related to genetic errors. If you don't know the cause of the disease, doctor, then run the genetics. And I'll bet you we'll find it in methylation pathway disturbances. And because, doctor, I have ringing in my ears. What causes that? I don't know. I have eczema. What's causing that? Well, I don't know. I got Parkinson's. Why'd I get that? Why did my son get ADHD? Why do I have migraines? There's no answers here. Thank God the government did the Human Genome Project, and we now can, find the errors in the genetics and the methylation pathways in particular and treat people. So I think the future of medicine starts here. Don't you think? A child is born, you manage their lifestyle, exercise, nutrition. Over time, you make sure their hormones don't decline and you treat their genetic errors. This is where it starts. And again, GEMS stands for Genetic Enzymatic Methylation Syndrome. The concept is you have genetic errors affecting enzyme speed. Remember we talked about 5 mile an hour speeds and the like in the methylation pathway. Here's a future idea. We've been talking about treating people within their biochemistry because we can't change their genetics, but maybe we can. Maybe at the level of stem cells we can change their genetics. Dr. Bakke and I talked about this today, and he came up with this interesting idea. He said, well, a child is born, you capture their umbilical cord blood, which has their DNA in it, and their stem cells as well. And if you look at their methylation pathway genetics, maybe with time we'll be able to fix those erroneous genes and then reinfuse those cells into the child with normal genetics. So maybe 5 years, 10 years from now, 15 years from now, mark my words, If we can fix your stem cells and give you normal stem cells that don't have those genetic errors, how interesting would it be that we could actually improve the quality of life of people enormously by actually fixing their genetics by going at them through their stem cells? Well, change requires two things: leadership and courage. And if you want to, read up on somebody who had both, this is Joseph Lister, and I'll tell you, he would tell us right now, change is really difficult. Dr. Lister, all he did was he washed his hands and he sterilized his surgical instruments, and he had a 95% reduction in death from surgery. And you know what? You'd think all the doctors in the world would say, oh my God, fantastic. All I have to do is sterilize my instruments and wash my hands, and I can reduce my risk of death from surgery by 95%. And you know what? People ridicule them. They say, what are you talking about? You're from Scotland. What do you know? That's what the people in London said. And it took years before people adopted Lister's ideas. And Lister, of course, as you know, is where we got the word Listerine from. And so his friend Louis Pasteur said, Joseph, the future belongs to him who has done the most to relieve the suffering of humanity. And I think that's where we are today. We have to cut right to the cause of disease. So if you're a hospital, you have a need, and your need is to lower the cost of healthcare because of the Affordable Care Act. Doctors, you're going to be stressed to improve patient satisfaction. And how are you going to do that? With Lipitor? No, I don't think so. You need another avenue to improve patient satisfaction and lower the cost of healthcare. If you're a payor who's paying the bills, it should be self-evident to you that attacking the root cause of disease is the answer. If you're a corporation, don't you want patients who are healthy and energetic and able to work well and don't get sick? And for those of you who have foundations and dollars, I think this is where you need to be putting your money to help push this field forward, to take the Human Genome Project and bring it to the forefront of care, because that's where it has to be. XR is doing its job as best it can to get the word out. XR is a think tank. XR connects to doctors. See, doctors are having a problem. They're overworked, they're tired, fatigued, and it's hard to teach doctors new strategies, especially something so new as this. But XR helps. XR can work through a doctor, any doctor, a neurologist, a pediatrician, a rheumatologist, a chiropractor, psychiatrist, neurologist, family practice, gastroenterology, ophthalmology, even here, ENT, plastics, surgeons, podiatry, dentistry, and we can take the knowledge that I've shown you here today and infuse it into the doctor-patient relationship. So to use an old line, so no one is left behind. So if a patient anywhere in the country needs or wants this type of medical care, we can help their doctor deliver it to them. If he's willing to change. Now, if he's not willing to change, then we have another avenue, which is telemedicine. And telemedicine is an upcoming model of healthcare where one very skilled doctor can deliver this type of care across all the states in which he is licensed. And that's a new paradigm that is coming. It's actually here. And this is a great way, I think, to get this care out there. So if you're a patient listening to this, if you're somewhere out in the United States, either we're going to work with your doctor or we're going to help you directly. But the bottom line is your needs come before anybody else's because you're the one suffering. So what's a reasonable next step for those of you who are listening that have medical problems? Run your genetics. We can help you do that. Register on our website at xrmd.com and run your genetics. It's a simple diagnostic tool. Take you 5 minutes to do. You literally provide saliva, so there's no needles involved, no appointment necessary. It's convenient. And we can help evaluate your data and work with you or your doctor, depending upon his willingness to change, because that really is the bottom line. A lot of what I spoke on today is published. When I gave a lecture at Southwest General Hospital, I had to go through the literature. The easiest way to do that is to go to PubMed and just use words like, well, I'll show you. Use words like glutathione or methylation and homocysteine, and you'll see how many articles come up in all the specialties. Here are specialties connecting macular degeneration to methylation as an example, and other diseases as well, cataract, diabetic macular edema, and the like. Even glaucoma, interestingly enough, had a connection with MTHFR. Neurologists who are listening, SAMI levels, which is, we talked about SAMI repeatedly, that's very much associated with Alzheimer's disease. How interesting is that? And other conditions as well, including demyelinating conditions and Parkinson's. What you won't find in the literature is anything on methylation and migraine. There's one paper back in 1982, I believe, or 86, where one part of the methylation pathway was published showing a peculiar therapeutic effect in migraine. So for those of you who are physicians, you know what that means. It means we are the first to take methylation bioscience and treat migraine. And a lot of that credit goes to Dr. Bakke, my PhD. I'm very lucky because I have a PhD that I work with. You know, MDs do not know their biochemistry. That's really the fact of the matter. And that's okay. You know, XR is positioned to help bring the knowledge base of biochemistry into medicine where, quite frankly, it belongs. But no one has published on the use of methylation for migraine. So we're very intrigued by that because we're the first to do that. Here's the gastroenterologist talking about inflammatory bowel disease, gastric cancers. Again, these are all these are articles that we found. Even interestingly enough, hepatitis C is affected by methylation. Rheumatology, without a doubt, lupus, rheumatoid disease, and other so-called autoimmune diseases. Endocrinologist, Graves' disease is a big one. And here's that paper on type 1 diabetes. DNA hypomethylation can foster type 1 diabetes caused by an autoimmune attack secondary to pancreatic damage. That's huge. That's enormous. I'm a little older now, but if I had children and I was young, I would absolutely run my kids' genetics because I do not want them hypomethylating. Cardiologists, we talked about endothelial cells and their health, and apparently methylation is connected to death of endothelial cells. We talked about this paper earlier on how inadequate methylation is the most common DNA lesion of cancer cells. Psychiatry, all these conditions here have relationships to methylation. At Harvard, they're using high doses of L-methylfolate. Remember that one? That was the MTHFR product. And they're using that for intractable major depressive disorder. You know, nice try, guys. I appreciate all of you. But, you know, you can't just give methylfolate. That just shows a lack of knowledge on what is methylation. You have to balance the entire pathway. These people who are depressed have multiple enzymatic problems in their methylation pathways. You know, giving one substance is passé. You know, medicine has to be multimodal. You have to give multiple things to balance out. It's like a chess game. It's not a game of tic-tac-toe. Autism, we talked about, they have problems with everything in methylation, methionine, homocysteine, cystathione, cysteine, glutathione, SAW, and the like. And dermatology, eczema, and all the diseases we don't understand. Bottom line, there are a great number of diseases caused, and I put that in quotes, caused by errors in hormones and methylation genetics which can be treated at the level of the cell. The current healthcare system must change to meet the needs of society, which are lower costs and better outcomes. I think this is the way to do it. We got to leverage all the knowledge from the Human Genome Project and make people healthy again.